Welcome to Immigrant News. I am your host, Elvis Santana, and today we are joined by Alex Rosenthal and Roy Chen. They're medical students at Brown University in nearby Providence, Rhode Island. Welcome, guys.
Thank you.
Thank you for joining us here. So first we want to understand a little bit about who you guys are and also your connection to the immigrant community. So let's start with you, Roy.
So I guess I'm a second generation American. My parents both came here from China through England and grew up here, been here 25 years, and now currently working with the Portuguese speaking community here in Providence and Fall River.
And you have no Portuguese background, but you do have a Chinese background.
Yes.
How did you connect with the Portuguese community in this general area?
I think at Brown we happen to have a very strong department because of the Cabo Verdean, Azorean, and Portuguese population in the area. It was just something that interested me, and it's turned into a wealth of opportunities for me to pursue as a student.
Wow, impressive. And Alex?
So similarly, my mom immigrated from Brazil when she was 16 and married an American man. And so just was raised speaking Portuguese. My grandmother, so my mom's mom, always lived in the house with us and helped raise us while my parents worked. So we just grew up speaking Portuguese with her and following some Brazilian traditions and cultures because of her presence in the home was very strong and influential. And so now here I'm at Brown as well. And like Roy was saying, there's quite a big Portuguese speaking community. And so in clinical settings and things like that, I'm able to connect with Portuguese speakers. And so that's been my biggest connection there.
That's amazing. So you guys are both third-year medical students at Brown.
Yep.
And have you guys picked any specialties yet of where your career will take you?
So I'm considering OBGYN, so obstetrics and gynecology.
Okay. And Roy?
Still pretty open, considering rehab medicine or sports medicine.
Okay. All right. So let's talk a little bit about your involvement with the immigrant community specifically. We'll start with you, Alex. What is your main focus or initiative or interface with the immigrant community around here?
So I would say that I'm doing a qualitative research project, so interviewing pastors in the Providence community about their role in the health of their communities. And so in interacting with Latin American pastors, I've found that they play a very strong role in the health of their communities and increasing access to care. So bringing resources to churches for people who are not able to see preventive medical care just because of immigration status or fear of going to the doctor, primarily because of immigration status, but also just emphasizing the importance of seeing the doctor regularly and getting care from doctors, because there's a lot of involvement in faith healing and just like believing that faith will heal. And while pastors do believe in that and they want to heal people as much as they can through faith, they also see the importance of people getting medical care for medical problems.
Now, do you feel that's more indicative of the legal status or the immigrant cultural background of the people in the church? I guess what I'm trying to ask is, is it unique to the Latin American, the immigrant community, that they have this involvement with health through their faith centers or church versus the native-born religious community? Like, is there a special need there?
Yeah, I think that I think it's a little bit of both, the legal status and then also just like the traditions of different churches. I think that you see it a lot in the African American community as well, but I also think that I think that that's probably pretty socioeconomically driven and people who traditionally have had more access to healthcare.
I find that interesting because I personally grew up in the Adventist church, which is very health driven. So we were exposed to a lot of food, diet. They're very big on veganism, vegetarianism. So before these concepts, these health concepts became more mainstream, you could say they are now, through the church, I was able to be exposed to a lot of that. Sure. So I find that interesting. So I was really curious about what you've been seeing in that outreach. And what about you, Roy?
So I worked through a volunteer program through Brown University. I was a volunteer interpreter in Rhode Island, and I primarily worked with the Portuguese-speaking population there for 3 years. Now that I'm on my clinical rotations, I unfortunately haven't had as much time to do that, but one of my clinics is only about 3 or 4 years old and based in Providence, so we are receiving a lot of immigrants primarily from Spanish-speaking Latin America, but also we've seen patients from Southeast Asia, from West Africa as well. And so being able to interact with those patients and try to help them adjust to the American healthcare system.
Now, was being an interpreter part of your curriculum course load, or was that something that you took on based on a need that you saw?
It was a program that Brown University had started a few years back. For me, as someone who was double concentrating in biochemistry and Portuguese and Brazilian studies, it was kind of this nice, rare opportunity to kind of bring my studies together. It just seemed like a good way to build on two sets of skills while also thinking about this potential career in medicine in the future.
Now, does somebody have to be a medical student or pursuing medicine to simply interpret from one language to another? I feel like that's something that people could volunteer to do. I mean, you just volunteered to interpret. Did you have to qualify to volunteer?
So there was a pretty extensive process, and to my understanding, it varies a lot from state to state, and even within some states, hospital to hospital. At Rhode Island Hospital, through our program, we had this pre-existing relationship where the interpreters would let us shadow them, and then they would shadow us to give us feedback on words that we might not be using, or like ways that we're interacting with patients or providers, like how we can improve those interactions. And eventually there was an exam that we had to take through Rhode Island Hospital. I know there are also in other parts of the country, there are state certifications or national certifications, so it kind of depends on the region.
Okay, so someone that's not involved in medicine could volunteer, go through these steps in order to, because I think on this show we want to always offer volunteer opportunities for people in our audience. Anyone that wants to help in the immigrant community is somebody that should always be welcome as far as we're concerned. So, okay, I mean, what else have you guys been doing interfacing with the immigrant community that you found is a bigger need that maybe more people should focus on?
Yeah, so I think clinically, something that is really important is getting prevention screening. So things like mammograms or pap smears or colonoscopies are things that we have standard screening protocols, and every so many years, starting at a specific year, people are supposed to, start getting those checks done to prevent more serious illness before it actually happens and catch it in an early stage or before it occurs. And I think that that's something that is very emphasized in U.S. healthcare that isn't necessarily emphasized internationally.
Preventative care, generally.
Sure, yeah, and screening tests also. And so that's just something to keep in mind also. If, you're now here, you have those opportunities and you have that accessible to you through primary care practices and places like that. And also some free clinics offer those types of screening and don't necessarily require health insurance. So if there's a free clinic in the area, that's also usually a good way to get those tests.
Do you find it's an issue of access or a cultural background where people aren't instilled with that preventative medical care?
I think it's a combination, right? I think that if you don't have access to primary care, nobody's telling you that you need these tests. And then, if that's not something you grew up with or grew up knowing about, because culturally that's not done where you're from, then it's a lack of information and a lack of awareness that this exists and that it's available.
Well, lack of information is one of the reasons why this show exists. So thank you guys so much for being here. I really enjoyed this conversation. And thank you. Hopefully we'll have you guys back as you're further along in your careers and you can share a lot more about, what you've been doing for the immigrant community. Thank you so much for being here.
Thank you for having us.
Well, thank you for joining us here in this edition of Immigrant News. Please find us on Facebook, immigrantenews.com. Look below in the comments. You could see everywhere that you could tune in to our future episodes. Thank you again.